House will come to order. Message from the Senate.
Message from the Senate, Madam Speaker. I hereby announce the passage by the Senate of the following Senate file herewith transmitted. Senate file number 12. Message is signed Cal R. Ludeman, Secretary of the Senate.
First reading of Senate bills.
First reading, Senate file number 12, an act relating to health and human services. Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Winkler moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that House File number 12 be given its second and third readings and be placed upon its final passage.
I call on the member from Hennepin, Representative Winkler.
Mr. Speaker, members, this is the motion to suspend the rules to take up the Health and Human Services Bill, and I would ask for a yes vote.
Is there any discussion on the motion? Hearing none, I'm going to Representative Truskowski.
Thank you, Mr. Speaker. I would urge a yes vote as well.
See no further discussion. Going to call for the vote. All those in favor say aye. Aye. Those opposed say nay. The motion does prevail. The clerk will give the bill its second reading.
Second reading, Senate file number 12.
Second reading.
There are amendments at the desk. If no objection, we'll let the author explain the bill first.
We have amendments at the desk, but if there are no objections, we'll let the author of the bill explain the bill first. Call on the member from Olmsted, Representative Liebling.
Mr. Speaker and members, when we finally got our budget targets, I could not imagine that we would be ready with this bill in time to be here this evening. But through incredible hard work and dedication of many, many people, we have pulled together a really good Health and Human Services bill. We started out with a joint budget target of a cut target of over $350 million, which is extremely difficult to meet, and yet we've been able to do a number of very important things. Of course, as with any omnibus bill, there are a lot of disappointments as well. The hour is late. I'm not going to go through this bill. It is still a very big bill, although a lot smaller than it left this body. But it has a number of very good things in it. But I would just like to take a moment to thank some of the people who were involved in this process, because it was a very challenging process. And even though, this is what the proverbial sausage being made, it's not always a pretty process, but I think the people of Minnesota should be extremely proud of the people who work for them in this institution, because they are incredibly dedicated, smart, hardworking, and sacrifice so much for the state. First of all, I want to thank my conferees, my fellow conferees for the House, Chairs Halverson, Moran, Schultz, and Hamilton, and of course the Senate conferees, Senator Benson, Senator Abler, Senator Utke, Senator Jensen, and Senator Marty, and also Representative Pinto, who, although he wasn't on the conference committee, played a huge role in helping to get this bill to where it is today. I also especially want to thank our partisan and nonpartisan staff who worked so hard, especially Doug Berg, our fiscal analyst, Randall Chun, Elizabeth Clarkvist, Sarah Sunderman, and Danielle Punelli. We had assistance from partisan staff, our researcher in the DFL researcher, Joe Durheim, and the Republican researcher, Jeremiah Wingstead, who also was extremely helpful in getting this with his members and working very cooperatively with us. The revisor's office on all of these bills has been absolutely amazing. And in the revisor's office, we had Ann Sexton and Sandra Glass-Serrani and probably others working under intense conditions to get this bill done. And finally, our intrepid team of of committee administrators who all joined together to help us. Laura Taken-Holtze, Chris McCall, and my committee administrator, Patrick McQuillan, who is the hardest working person I've ever seen in my life. So with that, members, I am not going to go through the bill because it would take many hours to do that and to talk about all the good and important things that are in it. One of the things that I'm very proud of, and I know that members on both sides of the aisle have worked on this for several years, is that in this bill, we have the first increase in the MFIP cash grant in 33 years, and that is $100 a month. And if you think about what you were doing in 1986, that was a long time ago. So we can all be very proud of this, and I know there's bipartisan support for that. We've got things in this bill that will help children in our child protection system, which is so important. We've got great provisions in here to move our mental health and substance abuse systems forward. We've got wonderful provisions to help with the smoking in the state and the disease and disease burden that causes. There are just so many great provisions here. And we have some very important provisions to address our health disparities as well. And those are especially important because we are not doing so well in that area. And we want to make sure that every Minnesotan has a full opportunity to fulfill their potential. And that means everybody's got to have the best possible physical and mental health. So this bill, for all its cut target, is really an excellent Health and Human Services bill. As you know, the Senate had cut all of the funding for our child care assistance program. That funding is back in the bill. We're kind of at status quo. But in addition to that, the House brought forward a lot of program integrity provisions to make sure that that program is tightened up and that the dollars we spend go to the people who are intended to have them. That is very important. I could go through some of the things that did not happen in the bill, but I'm going to just skip that due to the late hour and just move to one topic that I think is very important. There's been some discussion about the insulin bill, and as everybody here knows, prescription drugs and controlling prescription drug prices has been a big priority of this body in this year, and we moved forward a number of provisions to address that issue, including one that passed and has become law, which is the Pharmacy Benefit Manager bill. But we had other provisions in this bill as well. We had the Alex Smith insulin bill, we had the price transparency bill, and we had Representative Lesch's drug price gouging bill. Unfortunately, none of those provisions are in this omnibus bill. I want to make it very clear, we pushed for those provisions. In fact, when it comes to the insulin bill and the drug transparency bill, and I think the gouging bill as well, Representative Halverson was negotiating, trying to negotiate through the process of the entire conference committee and beyond. There's been some allegation that it wasn't in there because of a mistake that was made on our part, and that is simply not true. And I just want to tell everybody, because this has been raised in the Senate and it's all over social media, for my own part in this, and Representative Abler is claiming that that never happened. Representative Abler was not present when certain things took place. So this is a very intense process. Senator Benson was doing parts of the negotiating. Senator Abler was doing other parts. The conferees for the House were working on different parts of the bill. On the night, last night we were negotiating, Thursday night. Senator Benson was sitting on one side, Senator Halverson on the other. We were going through provisions in the bill. And I asked Senator Benson, are we going to get a deal on insulin? Because there was Representative Halverson with her amendment ready to go, trying to get to a deal, and Senator Benson said no. And that was the end. So we tried and tried and tried, because this is extremely important to us here in the House. We believe that the companies that are making so much money off of these drugs should be held accountable. The price transparency bill was similarly killed at the end of the process. And I just want to make it very clear that these are priorities of ours and that we will continue to fight on for these bills and for similar provisions to help Minnesotans with the price of pharmaceuticals. Another provision, like provision that did not survive in this bill, was the governor's One Care benefit package. As you may recall, there was the governor had a pharmacy benefit that was going to have all of the pharmacy for our public programs negotiated in one pool, not under our prepaid medical assistance program, but in a single pool, so that we would have the benefit of market power to get better drug prices. And that did not survive. The Senate would not agree to that provision. So I just wanted to be clear that bringing down drug prices remains a strong priority for the House. We want people to have access to life-saving medications, and we will continue to fight that fight as we did all the way through up until this point. So I am going to sit down, and I know that we have an amendment to take, and we will discuss that amendment. Thank you, Mr. Speaker.
There are amendments at the desk. Representative Hamilton offers the following amendment. The clerk will report the amendment.
Hamilton moves to amend Senate File Number 12. The amendment is coded A5.
I call on the member from Cottonwood, Representative Hamilton, to explain your amendment.
Well, thank you, Mr. Speaker and members. You know, I've been dealing with multiple sclerosis for about 25 years. I was diagnosed when my daughter was born. And I've been on a number of various treatments. And currently I'm battling both muscle spasms and pain. And through my doctors, they prescribed me the new, well, relatively new medical cannabis program. I do have a prescription for that. I went online and I subscribed. A day later, I found out that I have lost all my Second Amendment rights. Not only myself, but 20,000 Minnesotans are considered felons or being treated like felons, and it is wrong. By simply enrolling in a program that is legal, and not only in the state of Minnesota, but 35 other states, Mr. Speaker, along with 12 more that have derivatives from cannabis also. And so I've been fighting for this to raise awareness, to restore not only my Second Amendment rights, but like I said, 20,000 people across the state. In the meantime, I've spoke with Senator Klobuchar's staff, my congressman directly, Representative Poston, thank you for reaching out to your congressman, Representative Juergens, spoke to your congresswoman. I thank you for that. We do have Washington's attention, at least from the Minnesota delegates, and so we'll continue that push. At this time, Mr. Speaker, I'm going to withdraw that amendment. Thank you.
Representative Hamilton withdraws the A5 amendment. There's another amendment at the desk. Representative Baker offers the following amendment. The clerk will report the amendment.
Baker moves to amend Senate File Number 12. The amendment is coded A4.
The member from Candy, Ohio, Representative Baker.
Members, again, as it's getting late, I wanted to bring an important amendment to our awareness. As you all know, and many of you helped along with this way, my good friend and colleague, Representative Olson, and I carried an opioid bill that is going to save a lot of lives. We worked really hard to find new revenue from pharmaceutical companies that are joining our efforts to help people in our communities, especially the counties and so on. What happened in this process, when talking to many senators and representatives, that this tribunal effect, if we're going to call it that, leader court, whatever we want to call it, we had a lot of problems with that when it came to this opioid bill. And when I saw today in our HHS hearing, informational hearing, I saw Chair Liebling exhausted after the long and hard work that she has been put through. I saw the DFL staff and nonpartisan staff exhausted. Poor Chris McCall could barely open his eyes. These folks over there have worked so hard. And what I have been noticing the last few days is that our team had to just sit on the sideline and we couldn't participate after my connection, Rod Hamilton, was on the conference committee. He was my connection to make sure this opioid provision, which was part of the House, got included. After we went after midnight on Monday, that all changed. And members, we missed a really important piece of this opioid legislation that was agreed on by a lot of folks. $1 million. That's the only piece of the general fund this year that I was asking for, along with Representative Olson, $1 million to fund a fabulous program in Little Falls, Minnesota that is expanding doctors' knowledge of how to help people stay in recovery longer by subscribing medicine, medically assisted treatments that help people stay sober longer. They've got a great program. Members, this got missed. It was confusing when our chairs were back and forth talking about, is this in the bill or not, the opioid bill or not. This was the one piece that got missed. Members, please help me just find this little piece to put back in here, and it's going to be paid for by the pharmacy transparency bill that didn't get in here, but the funding got placed in there, so that funding went to the bottom line. So members, let's not get hung up on because it's not part of the scope of the leadership agreement. I want to throw up when I hear that anymore tonight. It's not, because we weren't part of that conversation. So let's do the right thing. Give us a little bit more for the opioid. Let's save some more lives, because this great place in Little Falls needs this support. They don't have any money right now, and we can't wait a year for this. Please help me support that. And members, I really would appreciate a roll call on this as well, Mr. Speaker.
Roll call has been requested. I see 15 hands. Seeing 15 hands, there will be a roll call.
Appreciate a green vote, Mr. Speaker. Thank you.
Any further discussion on the A4 amendment? The member from Hennepin, Representative Winkler.
Mr. Speaker, members, I would urge a red vote.
Any further discussion? Representative Munson.
Thank you, Mr. Speaker and members. This is an important bill here. I mean, I didn't support the opioid bill because I didn't support going after the opioid manufacturers in order to try to raise money in something that would be held up in court. But this was discussed in HHS all along, that this was going to give us the necessary startup money so that we can actually be doing good at fighting the opioid crisis now, as opposed to waiting 18 months under best conditions to get a penny out of this new opioid tax that's being assessed to not only the manufacturers, the wholesalers and veterinarians and medical gas suppliers and dentists and doctors and nurses all across the state. This is actually money what we should have been doing last year, which is paying for this out of our general fund so that we can get these programs started right away. We want to do something for the opioid crisis in Minnesota. This is the way we do it, and this was talked about all along, and I don't know how this was missed in the last bill. So, members, I urge a green vote.
Any further discussion? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The A4 amendment is not adopted. There is another amendment at the desk. Representative Pearson offers the following amendment. The clerk will report the amendment.
Pearson moves to amend Senate File Number 12. The amendment is coded A6.
The member from Olmsted, Representative Pearson, please explain your amendment.
Thank you, Mr. Speaker and members. Again, referencing for the second time my first term, our governor at that time, Governor Mark Dayton, was talking about the disparities in our communities and looking for ways to address that. And as that was occurring, I was discussing with members of the Senate programs that were effective in my community. And during my first term, a program called Project Legacy was selected and awarded a $100,000 grant. And those dollars were put towards helping out with mental health services, medical care, chemical dependency intervention, housing and mentoring, and counseling services for at-risk youth and newcomers to our country. We've had very great successes with that program in our community, and it was actually included in the Omnibus bill, supplemental spending bill last year at a price of $250,000, and we're looking to have that input in this Health and Human Services bill this evening as well. Again, helping out our communities in southern Minnesota, and actually it has a far-reaching effect into the metro area up here as well. So I hope that I can get the members' support this evening, and similarly we're using the savings of items that have been removed from the bill this evening as well. So I need a roll call on this vote as well. Thank you, members.
Roll call has been requested. Do I see 15 hands? Seeing 15 hands, there will be a roll call. The member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Is there any further discussion? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 55 ayes and 71 nays, the motion does not prevail, and the A6 amendment is not adopted. There's another amendment at the desk. Representative Hamilton offers the following amendment. The clerk will report the amendment.
Hamilton moves to amend Senate File 12, and the amendment is coded A7.
The member from Cottonwood, Representative Hamilton.
Thank you, Mr. Speaker. And before I forget, Mr. Speaker, I'd like a roll call, please.
Roll call's been requested. Do I see 15 hands? Seeing 15 hands, there will be a roll call. Representative Hamilton.
Thank you, Mr. Speaker. And members, this is the Alex Smith emergency insulin provision. And had you sat in the conference committee, you'd understand how important this is. It was tragic, the story that we heard from Alex's mother. And hearing the testimony, it brought almost everybody in the room to tears. And it's hard to believe that this day and age, anybody would have to lose their life because they could not access insulin. And what this provision does is it establishes a 90-day emergency supply for people who cannot afford it. Friends, this is the right thing to do. And I understand that this was up on the Senate floor and it failed. And we're taking a little bit different approach than the Senate. The Senate had a registration fee. We are funding this through, or my provision here is funding this through the Healthcare Access Fund. This is the right thing to do, and I think everybody understands that. Alex Smith, that's a name that we've heard, and I hope that's a name we never forget. I also serve on the Attorney General Task Force with his mother, Nicole Smith Holt, and I've talked to her and understand again, heard firsthand how tragic this is. We have the right thing to do by supporting this amendment, and I ask for your support.
The member from Hennepin, Representative Howard.
Thank you, Mr. Speaker. And I do thank Representative Hamilton for bringing this amendment and for your words and for your work this session on prescription drugs and to put a real human face on what we're doing here and the costs at stake for folks. And what you said, the name Alex Smith, I hope that we all remember that name. And, you know, members, I've had Alex's photo on my desk all session long. And to remind myself about why I'm here and to spark conversation with all my colleagues here. And absolutely, no one should lose their life because they cannot afford the insulin they need to survive. And I've been fighting for that all session long. And as Representative Hamilton mentioned, the Senate, it's just heartbreaking after fighting all this way that this was not included in the final bill. After all, the House passed this bill and our omnibus bill, and the Senate and their omnibus bill passed a substantially similar version, 65-0. Nobody has given a reason why we shouldn't take this measure on and commit to saving the lives of Minnesotans who can't afford insulin. And just a few hours ago on the Senate floor, we heard every excuse in the books from the Senate Republicans about why they didn't include this. They mentioned a spreadsheet. They mentioned worried about campaign literature, but there was not a single justification for what really is indefensible. That why should we not be ensuring that Minnesotans can afford insulin they need to survive? And I'll tell you, Representative Hamilton, if I thought there was any chance that we could get this bill to the governor's desk and signed into law, I would be punching the green button immediately. But the fact is, Senate Republicans and Senator Gazelka said no. And they owe an explanation to Minnesotans for why. They absolutely owe an explanation because we missed the line on the spreadsheet isn't good enough. Lives are at stake. And I do want to mention there is one difference in this amendment than the Alex Smith Emergency Insulin Act that we adopted here, and it's an important one. The amendment here would pay for this needed fund out of Healthcare Access Fund dollars. The Alex Smith Emergency Insulin Act would pay with the manufacturer's fee on the insulin manufacturers that have made billions and billions of dollars while jacking up the price of insulin over 1,200% over the last 10 years. An insulin vial that cost $20 in the 1990s now costs $300. Over on the Senate floor, we heard Republicans say, one of the drug manufacturers, Eli Lilly, they are offering a half-price insulin, so we don't need to do the Emergency Insulin Act. That drug still costs over $150 a vial, and I just want, since Sanofi was mentioned by the Senate Republicans, I want to mention that Sanofi, Eli Lilly, they had profits of $25 billion, or revenue of $25 billion last year, and profits of $600 million last year. And they paid an effective tax rate of $0 last year. These companies have made billions of dollars, and they absolutely should be held accountable for the harm that they've caused. That is vital. And there's no, again, justification for why we shouldn't do it. And the Senate Republicans, when they had their omnibus bill, they passed that insulin fee 65-0. We can and should do this, and it's heartbreaking that we're not going to be able to do it this session. Representative Hamilton, I would hope that we can work together on this. And if you can get Senator Gazelka on the phone in the next 3 hours, and he can change his mind and fight for this bill, we can all press green and we can make this happen. And I think everybody in this chamber would vote yes. But I'll tell you what, it is heartbreaking that we're not able to do the Alex Smith Emergency Insulin Act this session. And we are going to come back stronger and harder. There are Minnesotans outside these chambers that have brought us to this place, that have risen up this issue, like James and Nicole Smith-Holt. They are heroes. And they will not stop, and we will not stop until we ensure every Minnesotan has access to the affordable insulin they need to survive. Thank you, Mr. Speaker.
The member from Blue Earth, Representative Munson.
Thank you, Mr. Speaker, and Representative Howard for your hard work on this bill in this effort, and Representative Hamilton for bringing this forward. this has been a conflicting thing for me because I understand that a lot of the public wants us to do something about this. But where I draw the line is I understand our legislative restraint and what we can do at the legislature, and what you just spoke about so passionately is making companies pay for what they did. And at the legislature, we can't assess punitive damages to companies. That's not the role of the legislature. That's the role of the courts. And that's why I support, rarely, our Attorney General Keith Ellison in his lawsuit against the manufacturers of opiates, because if they cause damages, then it should be handled in the court, where we expect $1 trillion lawsuit for their damages. And if insulin companies are price gouging and using illegal practices, we should assess punitive damages in the court of law. It's not our role to be judge, jury, and executioner in assessing punitive damages to companies. We can set regulations, and I know what they're doing in Colorado with setting maximum prices on copays and things. When we start price fixing and setting prices, then the amount of money from pharmaceutical companies will pour into the legislature to buy votes to set prices that are favorable to them. The free market, as free as it can be in this industry that's so heavily regulated, has responded with bringing half-price insulin to the market. And I hope that they do more, because there is a demand. But I would much rather pay for emergency insulin supplies out of our general fund, out of our healthcare access fund, which is what it should be used for at healthcare costs, as opposed to being a laundromat for legislatures. We should be using this money for good and not burying it in the ground for broadband or doing other stuff. If we want to do this today, we should do this and make the Senate vote on this bill. I'm going to vote green. I will vote your green over here, and you can vote my red that I usually vote. But this is a good bill, and this is passionate, and people that are following you for this cause, they should want this, because it'll get what they want to do. And it's not our role to hold companies accountable with punitive damages and make them pay, which is, I know, the passion of what we want to do with opiates and with insulin, but that's not the role of the legislature. And if we start setting precedent like that, then you're going to get people running for office and assessing fines to companies, and it's unconstitutional. This is the role of the courts, but we can actually fund programs and do good through the general fund and through the healthcare access fund, so I'm going to vote green in this bill.
The member from Candy, Ohio, Representative Baker.
Thank you, Mr. Speaker and members. And I want to reiterate what Representative Munson was saying. I am very grateful that Representative Hamilton is giving us a different language version, Representative Howard, to show the Senate this is our cards. But I heard Alex's story because you brought it to us at HHS Finance. Don't you dare give up on this tonight because you're afraid of what someone else might do. That's the one thing I've learned around this place is you never give up. You've had his picture in front of you the whole session. Don't you dare vote red tonight. Don't you, and I can't say something about that. I don't want to cross my line, and I hope you don't, because you're passionate. This is your deal. This is your opioid bill from me. So I hope that you dig deep on this and just give the Senate a different look. This is not taking it from the pharmaceutical company. This is different language. This takes it from the Health Care Access Fund. So we have a funding plan. This is a good idea. It's the right thing to do, and it's going to help a lot of people. So I hope you rethink that. I hope you consider this, but never give up, and don't take a vote because of what you think might happen. Thank you.
The member from Wright, Representative Lucero.
Thank you, Mr. Speaker. And along those same lines, as I was listening to the compelling story from Representative Howard, I was not listening to the testimony or what was being discussed in the other body. But what I heard, Mr. Speaker, what I heard Representative Howard saying is that there was a litany of excuses why it couldn't happen. Well, then I heard you have an excuse. And I'm here to say, don't allow the other body, you referenced Senator Gazelka, don't let Senator Gazelka own your vote. You have an opportunity right now to vote green.
Mr. Speaker.
And if you vote green...
Point of order.
Representative Becker, Finn.
Point of order.
State your point of order.
It is not the member, but the matter at hand that is the subject of debate.
Yes. Yeah, members, we're on the A7 amendment, so please stay to what is the content of the amendment and not what others' motions or motives might be. So Representative Lucero.
Mr. Speaker, point of inquiry, I guess.
Representative Lucero, state your point of inquiry.
Is it not, I'm directly referencing what another member mentioned. The content of a senator, what happened in the other body, part of the discussion that occurred over there, and I'm directly responding to what another member said. Is that not in order?
I am not going to rule on this point of order. I'm just asking members to stay strictly on the content of the A7 amendment. So you have the floor, Representative Lucero.
Thank you, Mr. Speaker. Well, the content that another member brought up is what I'm responding to. The content. So, Mr. Speaker, they brought it up as part of this amendment, and therefore I'm continuing that dialogue. So thank you. Do not allow the other body to control us and our votes on this amendment. Mr. Speaker, Representative Howard, you have an opportunity right now to amend the bill and send it back to the Senate. And this amendment before us is different, my understanding, as Representative Hamilton explained, is different language than what was discussed in the other body. So we have the opportunity right now to vote green, to send it back and have that conversation this year. We do not need to wait, as you mentioned, to next year. We can have that dialogue now. No need to wait. Stand up for your sincere values. Thank you.
The member from Dakota, Representative Halverson.
Thank you, Mr. Speaker. I just wanted to make sure that we were extremely clear when we talk about this amendment, that this amendment is not the Alex Smith Emergency Insulin Act. Representative Howard worked incredibly closely with the Holt-Smith family to craft a bill that was well thought out and that served the goals of the people in the type 1 community that need protection, who are suffering from the gouging from these drug manufacturing companies. And I applaud Representative Howard's incredible commitment to this work, his genuine interest in working across the aisle to make sure that everybody understood how important this work is, and most of all, his commitment to the grassroots, the people who are out there asking us to take this action. And I have no doubt that this work is going to continue. These voices are going to be louder. We're going to see more action and more amplification around this particular issue. And I applaud Representative Howard for sticking with the bill that he authored, a bill that will really make a difference in the lives of people with type 1 diabetes.
Any further discussion on the A7 amendment? The member from Cottonwood, Representative Hamilton.
Well, thank you, Mr. Speaker. And this is the exact same bill, with the exception of it coming out of the Healthcare Access Fund. That's the only change. And you know what? Representative Liebling, Chair Liebling was right. We did push for these provisions. And it was in the first proposal. It wasn't a mistake by the House, like the Senate was accusing us of. And Senator Marty, he did send me a copy of the first proposal that the House had. We fought hard for this provision. And we have the ability to do the right thing here and now. And some of it's just profiles of courage. You know, I want to, especially for some of the freshmen, if you're struggling with this, back in 2008, I broke away from my party. And myself and about 5 other people, and we voted to override Governor Plenty's veto on a transportation bill. And we had our leaders, and we had a number of members from our caucus that didn't, they were pretty hard on us, if you will, but we stood firm because we knew it was the right thing to do. And so I would just encourage you to, if you're thinking about voting red, I would encourage you to vote green on this, because again, it is the right thing to do. Thank you, Mr. Speaker.
Any further discussion? The clerk will take the roll. The clerk will close the roll. There being 39 ayes and 82 nays, the motion does not prevail, and the A7 amendment is not adopted. There be no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 12.
Third reading. Any further discussion? Seeing the member from Fillmore, Representative Davids.
Well, thank you so much, Mr. Speaker. I'd like to refer in the bill here, as I've been reading it, to Article 8, Section 6 and 7, pages 450. And 451, Section 19, page 463, Section 22, page 464. The way the bill left the House, it had a provision to hire 50 people at Minsure to write checks directly to insurance companies. I want to thank, from the bottom of my heart, Chair Liebling for removing that provision and putting the reinsurance bill in for another 2 years. The way the bill was when it left the House gave checks directly to insurance companies. The reinsurance bill doesn't do that. It subsidized CEO salaries. The reinsurance bill doesn't do that. So I am so thankful for Chair Liebling for putting my provisions from several years ago into the Omnibus HHS bill. And to make it even better, this is probably the highlight of my 27 years in the House, to have the Speaker of the House, Nancy Pelosi, who supports this bill, to visit us here in Minnesota. Now, some have said she came here to support this reinsurance bill. I don't know if that's true, but I think it could be. So thank you, Speaker Pelosi. Thank you, Congresswoman Craig, for your tremendous support of the Davids reinsurance bill. And also, members, Senator Amy Klobuchar was very, very supportive. I'm sure she was with Speaker Pelosi tonight. I don't know if the issue of Speaker Pelosi being here to support this provision is true or not, but who knows. So again, I thank Chair Liebling for continuing and carrying the Davids reinsurance bill. Members, please remember, this bill works. This is the best provision in this bill. And just remember, you will never feel bad for doing the right thing. Thank you, Chair Liebling.
The member from Wright, Representative Lucero.
Thank you, Mr. Speaker. And just briefly to Representative Liebling, you and I have had some conversations regarding reinsurance. My understanding, as we just heard, is that reinsurance provisions are in this bill. And so, Mr. Speaker and Chair Liebling, I am reaching out. Let's stand together in our opposition to reinsurance. Let's vote red on this bill and show our unity on this issue, and vote against reinsurance that's in this bill. Thank you.
The member from Morrison, Representative Kresha.
Thank you, Mr. Speaker and members, and thank you, Chair Liebling, for this bill. Just quickly, it's sometimes the things that don't get talked about that I think have the most profound impact, and Representative Moran We've worked hard on the child protection. There's many people that we've educated and built relationships around, and I just thank you for including the Child Protection Training Academy.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker and members. Well, I'm here to stand on the House floor to talk about childcare fraud. Shocker, huh? So when the HHS Omnibus bill left the floor, it was very weak, extremely weak. It was so weak on fraud prevention. The bill before you is better on the prevention part of it, thanks to the Republican Senate. So if the Republican Senate is watching this right now, I want to thank you for the work that you did bringing some integrity into this bill. We applaud you. Thank God for the Senate. This bill includes some additional anti-fraud provisions, including sanctions for child care provider financial misconduct that includes penalties for providing materially false information. Thank you, Senate. I am pleased that this bill provides the least amount of new funding necessary for the Child Care Assistance Program when there remains rampant fraud in this program. Taxpayers, thank you, Senate. When the bill left the floor, the federal compliance provisions cost more than $8 million, but now there is a low cost of $659,000 in general fund spending. Thank you, Republican Senate. However, this bill continues to provide loopholes under the guise of federal compliance. Despite efforts by the other chamber, this bill fails to provide for an independent office of Inspector General or even an independent anti-fraud unit free from political interference. BP is not housed with the EPA. Our Inspector Generals need to be free from political interference, from DHS, or just plain old bureaucratic mismanagement. And I do fear that after we adjourn, that our Inspector Generals are going to be retaliated against by DHS for the good work that they are doing in trying to prevent fraud and protecting your tax dollars. Members, this bill is much better than the bill that left this floor, but we have so much more work to do to address the severity of fraud rampant within the Child Care Assistance Program. Members, while there is a lot of good in this bill, including restoring the $68 million in cuts to nursing homes, I will be voting no on this bill.
The member from Blue Earth, Representative Munson.
Thank you, Mr. Speaker and members. I really enjoyed my time on the Health and Human Services Finance Committee this year, and thank you, Chair Liebling, and members that were on the committee for a great discussion on many bills. I wish we would have taken more votes in the committee. I wish we would have taken votes on bills. So many people come to the Health and Human Services committees. They're passionate about health care changes, and they bring dozens of people. They print T-shirts for their cause, and they come and hear testimony. They give testimony, and then we don't hear a vote because everything's rolled over for possible inclusion in an omnibus bill. It was frustrating to see the bill was over 1,000 pages before. It's nice that it's a lot lighter. It's almost pocket size, and it's a decent read. It's much better coming back in this form. But as Representative Lucero said, unfortunately, it has reinsurance in it. And reinsurance, for those of you watching at home at 3:30 in the morning because you're not doing anything else, actually 4:09 in the morning, reinsurance is single payer government health care. It requires that the government be the one that pays 80% of the health care costs between $50,000 and $250,000 for all private insurance. So if you have private insurance and your health care exceeds your deductible of $10,000 or $15,000, and your health insurance company pays between your deductible and $50,000, big government's going to step in and be the single payer for 80% of your health care costs up to $250,000. It's not backdoor way to socialize medicine. This is walking it right in the front door. That's why Nancy Pelosi loves this plan, because it just takes all the risk from insurance companies and puts it onto the government so that the government starts paying our insurance, paying all the medical costs. And then it's not that big of a step to just close the gap between your deductible and the $50,000 that is for where the government kicks in now. And then we're at single payer. So I do not like this plan. Other stuff that I don't like about this bill is the CCAP. I wish we could, when we identify so much fraud in a program, we really need to either turn it off until we fix it, or really dig in and put some major reforms to fraud. And Representative Friends, and thank you for championing so much on the child care fraud front. And we need to do more, especially with having an independent inspector. And I would like to see an independent prosecutor that all they do is prosecute government fraud, because county prosecutors have to choose between prosecuting violent crime and prosecuting white-collar crime and fraud, and it's very difficult to prove these cases. So we need an independent prosecutor. I'm very disappointed, and Representative Baker spoke to this, about the $12 million in the opioid startup costs that we're supposed to jumpstart this program for all these great things we're going to do to fight the opioid crisis, as opposed to waiting 18 months at the best case scenario, or several years if it goes to court, and I think it would. On page 932 or on line 932 of the spreadsheet, page 26 of the spreadsheet, which is like the cliff notes of this enormous bill, we see $145 million in savings that's going to be coming from the reduction of forecast assumptions for managed care payment trend, so 0.8%. We project it's going to go the right direction. We are banking $145 in this bill, and the projections are so loosey-goosey that we've actually decided that we're going to gamble with sick people's dollars. So this is going to be backfilled. It's a contingent backfilled from the Minnesota Premium Security Account. Greg Davids' piggy bank over here for reinsurance. Representative David, sorry, his piggy bank for reinsurance. If these numbers don't turn out to be true, in other words, if we actually don't realize the savings, and we're going to have to work to realize the savings in some of these costs, to work to reform medical assistance, to work hard to renegotiate those contracts to get the best price. And if we don't realize that $145 million in savings, we're just going to take it out of the piggy bank over here. The premium security account that pays for reinsurance. And where does that money come from? From sick people, from the sick tax. So we're taking money from sick people, putting it in the piggy bank for reinsurance, which is what we're gambling with on some of these provisions. This is a tight budget. This doesn't work. This is not financially responsible. And it's not the only gamble in here with people's money. So this is a tight budget. I don't know how I don't think we're gonna realize it when there's always a backfill piggy bank that we can go and break open. People aren't gonna really work hard for those reforms. So members, I'm not gonna vote for this bill today. There is some good stuff in here. The Senate cleaned up a lot of language and a lot of provisions in here, but it's not good enough for my vote, and I'm gonna be voting no. Thank you.
The member from Rock, Representative Schumacher.
Thank you, Mr. Speaker and members, and I just want to take a moment to thank Representative Liebling and the conference committee for all the work. I've done the conference committee a few times around. I was fortunate or unfortunate enough to not have to do it this time, and there's so much work that goes into this one. Everyone has a lot of work that's done in conference committees, but their conference committee bills usually don't go into the 4- and 5-digit levels for the page counts. And so I just want to thank you for that. And there's a lot in this bill to be talking about, but today I just want to thank the members who are voting for this bill today for the provisions on swing beds, and to thank Representative Liebling one final time for carrying this provision in. I've tried for 4 years to get this done, and under this you were able to find a solution that's going to work, that actually puts the patient choice back into the part of care that we really need to be focused on. And so I just want to thank you for that, and ask for members to vote on this bill.
The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, briefly, there are many great early childhood provisions in this bill, but what I would just want to focus on is just making sure to reassure members about the program integrity issues relating to child care assistance. You may remember when the bill left the House floor, there were 5 areas that I identified where we were doing a ton in the bill to address that. Identification of any wrongdoing, increasing investigation and response was area 2. Increasing the consequences and preventing any further wrongdoing, number 3. Increasing transparency, number 4. Number 5 was to prevent wrongdoing in the first place. Well, members, we had a ton to address integrity of the child care assistance program when this bill left the House floor, and I'm glad to let you know that we have almost all of it coming back, and almost everything about program integrity in this bill before you comes from the House. It is true that the Senate did make some changes. In particular, what they did is they actually took out a crime that we had passed from the House floor that would impose penalties for accepting or giving a kickback relating to a fraud in the program. That is something the Senate actually took out. So unfortunately, members, I'm sorry. I know that our team pushed very hard on that, and for whatever reason, the Senate was not willing to go forward on that aspect. But members, we were able to hold on to so much of the program integrity work that came out of our bill, and in particular, finally, members, area number 6 for program integrity. Program has integrity when we are actually funding the program, and I'm really sorry that so much of the support from the funding was lost, but I'm very glad to let members know that we were able to move forward on federal conformity, which will make sure that we do have continued support for this program, which is so important for the children and the families that depend on it. I will proudly vote in favor of this bill, and I know that you can too. Thank you.
Call on the author of the bill, the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Just to conclude, I mean, it is 4:15 in the morning, kind of a late hour to be discussing a bill like this, and so I will be brief. But I do want to just respond to some of the things that have been said. First of all, this bill, of course, is a compromise. As others have said on this floor tonight, we have a DFL majority House and a Republican majority Senate, and so the bills are going to be a compromise. There's no other way to get this done. So yes, the reinsurance program is in this bill. It is still, always has been, a program where insurance companies are given money that comes from the public to help pay for the claims. Yes, so we are giving checks to insurance companies under reinsurance. It is still a very bad policy. It is still a very expensive policy. It costs us money that we would otherwise get from the federal government, which is now actually on the spreadsheet. I never saw it on a spreadsheet before, but now we do know that it costs even more than it cost before. And it's on the spreadsheet. You can see in 2021, the additional cost of the program, just what we lose from the federal government for our Minnesota Care program, is $115+ million for this coming biennium. And in the tails, it's $72 million. So this is a bad program. I persist in believing this is a bad policy. We should not be doing it. But it's compromise. And in exchange for this, although it's not in our bill here tonight, we're continuing the provider tax. So for 2 years, we'll have a terrible, wasteful policy that probably doesn't even do that much to control insurance costs for folks. Who knows, maybe it does, maybe it doesn't, but it's extremely costly and ineffective for us. We could do so much better, but we're not. I'm letting you guys continue that program. We've made that deal for 2 years, and we are going to continue the provider tax, which to me is far more important, even at the level of 1.8% instead of 2%. So I thank you for that deal. I think it's a good one, and I think it's extremely good for the people of Minnesota. We know that this reinsurance plan, you know, it's extremely important too. It's extremely important to the insurance companies. Boy, did they lobby for that program. It's important to them. Well, you know what? I don't work for the insurance companies. I work for my constituents and for the people of Minnesota, and I hope that you do too. So just Just to emphasize the point on what Representative Pinto said, I'm very proud of the program integrity provisions in this bill. The House worked extremely hard to get those into the bill, and Representative Pinto is correct. The Senate refused to take one of our strong positions because they hadn't heard it, it hadn't gone through their committee structure. But we got plenty of strong provisions, and those came from the House. Make no mistake about it. Those were Representative Pinto's work and the work of other people in this body, and they came from here. And I think you can all be proud of that. There are so many good provisions in this bill. I thank the members who have helped me create it, both Republicans and DFLers. There's a lot of people's work here, and I think you can vote for this bill, even if you don't love everything in it, and even if you're disappointed that something isn't in it, because, as I say, it was a very tough target. That's always going to be the case, but I would urge you to vote yes for this very good Health and Human Services bill. Thank you.
Any further discussion? Not, the clerk will take the roll. The clerk will close the roll. There being 77 ayes and 51 nays, the bill is passed and its title agreed to. The next bill on the calendar is House File number 1. The clerk will report the bill.
House File number 1, an act relating to education. Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Winkler moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that House File number 1 be given its second and third readings and be placed upon its final passage.
I call upon the member from Hennepin, Representative Winkler. Explain the motion.
Mr. Speaker, members, this is the motion to suspend the rules to take up the education bill, and I would ask for a yes vote.
Is there any discussion? The member from Wabasha, Representative Drazkowski.
Thank you, Mr. Speaker. I encourage a yes vote as well.
Any further discussion? If not, all those in favor of the motion, please say aye. Those opposed, nay. The motion does prevail. The clerk will give the bill its second reading.
Second reading, House File number 1.
There are second reading. There are amendments at the desk. I'm going to call, with no objections, I'm going to call on the author to explain the bill, the representative from Hennepin, Representative Davnie.
Thank you, Mr. Speaker, and good morning, members. I'd like to start actually by thanking the amazing staff that have worked so hard these last weeks on this bill. Tim Strom, Christina Pera, Emily Adrians from House Nonpartisan Staff, Sarah Burt, the committee administrator, Brittany Sunderland, the committee legislative assistant, Adrian Benjamin, the committee administrator for both the education policy and early childhood committees, Mars Rudquist, the DFL researcher, and Jody Withers, the GOP researcher. I've moved from great respect for those people to simply awe and amazement at the intellect and energy and ethic that they bring to making our bills better. I also want to thank the conferees, Chair Joachim, Chair Pinto, Education Finance Committee Vice Chair Sandstead, and Representative Erdahl for their work on this bill. I'll let Chairs Joachim and Pinto talk about their portions of the bill, but what you have before you, members, is a solid bill for Minnesota students and families. What left the floor was exhibited a greater commitment, but this is the product of the conference committee process. It invests 2% each of the next 2 years on the general education formula. It includes the House provision of $91 million in special ed funding to freeze that cross-subsidy and make sure that that 2% and 2% increase in the general education formula that every district receives is available as 2% to go into programs, salaries, and opportunities for children. It makes permanent our commitment as a state to all of Minnesota's children by linking the state's general education formula to the students attending the 4 Bureau of Indian Education schools within our state. It funds the Department of Education, the Perpich Center for Arts Education, and the state academies, our obligations. The House carried a number of equity provisions in that are important, including $1.5 million in recruitment and retention of teachers of color, so the people in the front of the classrooms look more like the students filling the classrooms in districts across the state. Number of other provisions that I'm glad to talk about, including expanding the collaborative urban and greater Minnesota educator grants and making for the next 2 years the high school equivalency testing, the GEDs and other opportunities free for those Minnesotans who need those. We did, of course, accept a number of Senate provisions, such as allowing 10th grade non-public students to take CTE courses as their public school peers can do, funding for the McPhail Center for the Arts to provide opportunities, distance learning opportunities to schools in greater Minnesota, and grants to 5 greater Minnesota members of the Education Partnership Program, and a P-TECH model for schools in the Rochester district. I'm particularly interested in this because it starts Minnesota down the road to offering free community college. I'm excited about that. It's something that I've supported for a number of years, and to see that proposal coming from the GOP, I think, is an exciting development. There's more to say, including helping out students in Breckenridge, access PSEO, CTE courses in North Dakota, but that's about safety and access, as well as reestablishing the certificate incentive program for those students who wish to graduate from high school while walking out that door with a professional certificate that allows them to walk right into the workforce. Other provisions I can speak to, but at this time, Mr. Speaker, I'd like to hold my comments for later.
Call on the member from Hennepin, Representative Joachim.
Thank you, Mr. Speaker. I would like to echo Chair Davnie's thank you to staff and fellow members of the Conference Committee, and a special thank you to the Education Policy Team. While we did not get some of our House priorities across the finish line this year, this bill is a very good start, and we definitely have some wins to celebrate in the fiscal area and money going to our schools. We fought really hard to overcome the 0.5 and 0.5 that on the formula that the Senate had in their first offer. So there are also some good policy provisions in here that we worked on together with the Senate. Many of the policy changes were technical, but I will mention some highlights. We added language around increasing teachers of color and Indigenous in the classroom, with language around grants and mentorships. We came together on a few provisions around reducing special education paperwork. A House provision adds a requirement to screen all students K through 2 for dyslexia if they're showing difficulties in reading, and a Senate provision that adds requirements for training for teachers around dyslexia as part of their license. We encourage school districts to provide mental health instruction for students starting in 4th grade. There's also a requirement for MDE to investigate allegations of maltreatment involving students through age 21. With the help of the Senate, we clarified language for districts when it comes to testing for lead in our schools and requires schools to track energy consumption to find efficiencies and savings. And we agreed on allowing districts to donate or sell used computers or tablets to students on a basis of need. But there are also some disappointments in regards to policy that did not make it, that we will definitely be revisiting next session. Many of those policies revolve around equity. We are unable to get the House lunch shaming language into the bill this year. There's still more work to do on special education paperwork reduction, getting more teachers of color and Indigenous in the classroom, as well as increased training for our teachers and school support staff around childhood trauma and mental health. We also have some work to do on non-exclusionary discipline policies and suspension, and we couldn't get anything for testing for radon in our schools, so we'll be revisiting that next year as well. But this is what compromise looks like in a divided legislature, and I'm happy that we could come together to get some resources to our students and our schools. So yes, the bill's a good start, and speaking from our education policy team, we are already ready to roll up our sleeves and get to work next session on some good policy that will improve things for our students, teachers, and schools, so I ask for a green vote.
The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I'm going to briefly discuss the early childhood portion of the bill, and a reminder that the opportunity gaps that we see in schools start well before then, and that's why our vision throughout this session has been to get every child off to a great start. And with the Health and Human Services bill that we just heard, this bill does take strong steps towards that. So 4 highlights really quickly. Number 1, $4.5 million for early learning scholarships, expanding those opportunities for hundreds of kids statewide. Number 2, there's funding for a pilot program for college savings accounts. These are in use at more than 30 states around the country, which have found when you create a bank account, put even a small amount of money in the earliest weeks and years, can have a huge impact on student achievement and so much more. Number 3, there's a program called Reach Out and Read, which is in use in much of our state right now. It puts pediatricians in the role of literacy experts, and this is going to expand this out to many more greater Minnesota communities in particular. And finally, and I'm most excited about this, we are preserving 4,000 pre-kindergarten slots statewide to allow those young kids to be able to take advantage of this high-quality opportunity. Members, again, every child off to a great start. This is a vision that we have, and when we get that challenge right, every other one that we have can be addressed. And we all benefit when that happens. So while there's more that we can do, this is a good start for that great start vision. I'm proud to support and encourage you to do as well. Thank you, Mr. Speaker.
There are amendments at the desk. Representative O'Neill offers the following amendment. The clerk will report the amendment.
O'Neill moves to amend House File Number 1. The amendment is coded A9.
The member from Wright, Representative O'Neill, to your amendment.
Thank you, Mr. Speaker and members. This amendment requires the Minnesota Department of Education to assist school districts to comply with federal Title IX requirements to prevent sexual harassment and sexual discrimination in education. And it has a $292 fiscal change from another fund, moving it into this fund. And I would ask for a roll call, Mr. Speaker.
A roll call's been requested. I see 15 hands. There will be a roll call. Call on the member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Any further discussion? See none, the clerk will take the roll. The clerk will close the roll. There being 51 ayes and 77 nays, the motion does not prevail. The A9 amendment is not adopted. There's an amendment at the desk. Representative Kresha offers the following amendment. The clerk will report the amendment.
Kresha moves to amend House File Number 1, and the amendment is coded A10.
The member from Morrison, Representative Kresha.
Thank you, Mr. Speaker. I'd like to request a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Kresha.
Thank you, Mr. Speaker. Members, this moves money out of the MDE litigation funds into the Innovation Mental Health Grants. It's a good way to fund this, and I urge a green vote.
And he's the member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Any further discussion? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The A10 amendment is not adopted. There's an amendment at the desk. Representative Damath offers the following amendment. The clerk will report the amendment.
Damath moves to amend House File Number 1, and the amendment is coded A11.
The member from Stearns, Representative Damath.
Thank you, Mr. Speaker. Members, what this amendment does, the A11, is it takes and establishes a grant to the Metro Deaf School to provide services to young children who have a primary disability of deaf or hard of hearing and who are not eligible for funding under Minnesota statutes, so those children that are age 0 to 3. The funding for this would be taking half of the money that is established in the College Savings Account pilot program and would take $125,000 in the year 2020 and $125,000 in the year 2021. And I would ask Mr. Speaker for a roll call, and I would encourage a green vote.
Roll call has been requested. Seeing 15 hands, there will be a roll call. The member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Any further discussion? Not, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The A11 amendment is not adopted. There's an amendment at the desk. Representative Bennett offers the following amendment. The clerk will report the amendment.
Bennett moves to amend House File Number 1, and the amendment is coded A12.
The member from Freeborn, Representative Bennett.
Thank you, Mr. Speaker. And members, this is a program I just want to tell you a little bit about that's happening in the Fairmont schools, which is about 1 hour west of Albert Lea. It's a vocational enrichment program where they offer a welding class on Saturdays. Unfortunately, though, that welding class is not funded because it's held outside of the school day. This program actually helps students who are struggling and the high flyers who normally wouldn't be able to take welding during the day but are able to take it on weekends. It also involves other school districts such as Blue Earth where students can travel from Blue Earth to Fairmont on a Saturday and take a welding class. It's been highly successful for those students from both Fairmont and Blue Earth and the surrounding areas. But unfortunately, this did not get into the final bill. So my amendment members would take this vocational enrichment program, provide grants so that not only the Fairmont schools can get reimbursed for this excellent program, but other schools can do the same type of thing. And members, I think what we want to do here is get the most educational bang for our buck. This is a proven and successful program. We want to encourage this to go throughout the state. It takes the funding from the St. Paul College savings account, and you all know I love kids. I have nothing against the kids of St. Paul, but members, this vocational program would have an impact statewide and an educational impact to boot. So I would just encourage a green vote. I would ask for a roll call, please.
Roll call's been requested. Seeing 15 hands, there will be a roll call. Representative Bennett.
Thank you.
The member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Is there any further discussion? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The A12 amendment is not adopted. There is an amendment at the desk. Representative O'Neill offers the following amendment. The clerk will report the amendment.
O'Neill moves to amend House File Number 1, and the amendment is coded A13.
The member from Wright, Representative O'Neill.
Thank you, Mr. Speaker and members. So this amendment helps out Monticello School District and also Duluth School District. They both have had issues with their special education funding formula. Particularly Monticello had an issue that's gone back several years now, and they're short about $800,000 per year. So this amendment would take $800,000 per year going forward, split it evenly between Monticello and Duluth, and make them closer to whole. It doesn't make them completely whole, but it does help them with an error that was created a few years back by MDE and helps them with their special education money. So I ask for a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative O'Neill.
Thank you, Mr. Speaker, and I ask for a green vote.
The member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Any further discussion? See none, the clerk will take the roll. The clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail. The A13 amendment is not adopted. There's an amendment at the desk. Representative Erickson offers the following amendment. The clerk will report the amendment.
Erickson moves to amend House File Number 1, and the amendment is coded A2.
The member from Mille Lacs, Representative Erickson.
Thank you, Mr. Speaker and members. And Mr. Speaker, this amendment would provide for a grounds for revocation, suspension, or denial of a teacher license by PELSB, which is the Professional Licensing and Standards Board, and BOSA, which is the Board of School Administrators, if the teacher was convicted of a domestic violence or an embezzlement of public funds. And I ask for a roll call, Mr. Speaker.
Roll call has been requested. Seeing 15 hands, there is a roll call. There will be a roll call. Representative Erickson.
And thank you, Mr. Speaker. I ask for a green vote.
The member from Hennepin, Representative Winkler.
Mr. Speaker, members, I urge a no vote.
Is there any further discussion? Not, the clerk will take the roll. Clerk will close the roll. There being 54 ayes and 74 nays, the motion does not prevail, and the A2 amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 1.
Third reading. Members, discussion. The member from Sibley, Representative Gruenhagen.
Oh, thank you, Mr. Speaker, members. Members, I just want to comment. I know there's been a lot of work that has gone into this, a lot of compromise, and I appreciate some of the results of the compromise. But I had an amendment to have a special ed study and find out why we're labeling and drugging so many of our K-12 children in this state compared to other nations, and especially when it's on a subjective basis. I just want to thank members. That amendment came off this House floor with strong bipartisan support. I think over about 93 votes for it. I do believe, members, this is a crisis in our schools, the labeling and drugging, excessive labeling and drugging of our children. You know, these psychotropic drugs are some of the most powerful on the market. Anytime you hear an advertisement about psychotropic drugs on TV, they have severe consequences, including suicidal thoughts. Mr. Speaker, could you calm the... Not that they're listening, but at least they're awake, I guess. But, you know, they have strong consequences even to adults, suicidal thoughts. And I'd urge members after this session and before the next, talk to your military recruiters. These psychotropic drugs used on developing children impair their ability to get into the military, along with a lot of other negative effects. And members, I emailed you earlier in this session an article from a Harvard study from this year, or from 2018, and it shows the dangers of early school enrollment and the labeling and drugging of preschool children, members. Now, when I shared this in committee, my concern about this, I had one of your medical members come up to me and she said, I agree we are labeling and drugging too many children, and especially minorities. So members, please do some research on this. I'd like to bring it back next session, and I think we really need to get to the bottom of this. And again, I want to thank the strong bipartisan support for the amendment and for finding out why this is going on in our schools. Thank you, Mr. Speaker and members.
The member from Wright, Representative Lucero.
Thank you, Mr. Speaker. This entire session, there are probably 3 terms that I've heard more than any other: disparities, equity, and opportunity gap. I've heard them over and over and over again, members. In my opinion, most of the time, misplaced. But here is an example of a true disparity, inequity, and opportunity gap. And earlier this afternoon, when the runs came out, I looked at them. In fact, I was studying them so intently, I didn't see my coffee cup, so I have my coffee-stained runs here, spilled all over it. But I was doing the math. One of my school districts is St. Michael Albertville, and right now I believe that they are the second from the bottom in per pupil funding. And members, that is among the highest priorities of the great community that I have the honor of representing. And equity in education funding isn't unique to my area, but there are multiple areas of the state that have this problem. And my entire time in office, I've been fighting this, banding together with other school districts. We call ourselves C, Schools for Equity in Education, I've been the co-author and chief author of multiple bills seeking to address this serious problem. And I am honored to have co-authors on both sides of the aisle, because this is not a partisan issue. But I'm looking at these runs, and right now, this school year, the difference between Minneapolis School District and Metro School and St. Michael Albertville, second from the bottom, $5,433 per student. And under this bill, members, next year the gap gets wider, $5,519. And in the second year of the biennium, it continues to widen, $5,744 per student. The difference between Minneapolis and STMA. Members, that results in disparities, true inequities, and educational limitations in educational opportunities. It's my strong opinion that it should not matter what a student's zip code is in terms of the educational opportunities they have access to. As a former educator myself, education is a high priority for me, and those that have maximum educational opportunities in the K through 12, it sets people up for success for the rest of their life. And it's abhorrent to me that yet another year not addressing this problem, continuing to make it worse, is a missed opportunity. And again, it's not just a detrimental impact for my area, but it has a detrimental impact for multiple members on multiple areas of the state on both sides of the aisle. And I hope that we will begin to one day take this seriously and not continue to widen the gap. So, members, I am a no on this bill. Thank you.
The member from Meeker, Representative Erdahl.
Thank you, Mr. Speaker. Civics.
The member from Morrison, Representative Kresha.
Thank you, Mr. Speaker, members. And I'll be brief. The funding is in the right spot. We put the formula in place with the 2 and 2 and the special ed cross subsidy. And we pay attention to the right things with the funds we had, the realistic funds we had. Early on, we talked about this bill when it first came off the House floor. There was lots of fanfare for lots of policy, lots of provisions, but the reality was we had to deal with what was in the budget. And we talked about that. And we talked about doing the right thing for the schools within the means of government. The gas tax was not popular. It was not going to be a way to get this above and beyond what was realistic for that. And for that, divided government worked. It gave us the opportunity to really look hard and do what was right and fulfill our constitutional obligation of funding education. What is not in this bill is equally important. We no longer have the very controversial Planned Parenthood sex education mandates. The bill no longer lowers teacher standards, and the bill no longer provides loopholes to allow teachers convicted of assault or domestic abuse to keep their license. The bill no longer includes state mandates tying the hands of teachers who need to be able to maintain order in their classroom. And lastly, the bill no longer eliminates the early learning scholarship for 4-year-olds. We left that intact in this bill. Good provisions in what was available, and I thank the chair across the aisle for the work that you've done and for all the people that put in policy. And with that, I can support this bill.
The member from Mille Lacs, Representative Erickson.
Thank you, Mr. Speaker and members. Well, this is an acceptable proposal, and I will be voting yes for it. But to help you, Representative Lucero, understand what drives the differences, my largest school district, Princeton, is at $10,200 per student, per pupil in the first year. And one of my smallest districts, Onamia, is well over $15,000. So the variation occurs because of the way the formula works. General education has many formulas tucked into it that drives that, and then we have special education. So just so you understand that. But this is an acceptable proposal in that we no longer have a gas tax increase that's funding this. So we don't have to, or the majority doesn't have to take from what we did last year or the year before in providing money for transportation to fund education. So that's a good thing, and that makes it acceptable to me. Furthermore, as Representative Krisha mentioned, some of the harmful policy, at least I consider it harmful, is gone. We don't have the sexual health education program. We no longer are lowering the compulsory age of our students to 6, which would force many students or many parents, I think, into choosing an option that's outside formal education because they'd be found non-compliant if they didn't get their children enrolled in school. Teachers no longer would be required to use the non-exclusionary discipline practices or policies before suspension or expulsion, which I think is really hard on our teachers. We have to give them some authority in the classroom. And of course, very important to me is the fact that the teacher licensure that we completed in 2017 is untouched and will live for another year, so we can find out now in its infancy how it plays out. So thank you, members, very much.
The member from Isanti, Representative
Thank you,
Dowd.
Mr. Speaker and members. I know we're trying to all get to sleep at some point, so I'll be really brief. But there's one thing that I want to talk about that has been a pet peeve of mine since I've been here, and having served as Speaker for a couple of terms, it's how we fund our schools. Just very simply, we've gotten in this bad habit of doing a 2% increase the first year and another 2% increase the second year. The problem so you get 2% in the first year of the biennium, you get that same 2% the second year, and then another 2% on top of it. So that's a 6% for this biennium. To continue that same level of funding in the tails, you need 8%. Okay? You need for the first year and for the second year for 8%. So it's actually, by funding our schools in that way, you actually create a tails problem every time. Now, the schools don't actually get that money. We still have to come here and vote for it, so they don't get it. You still have to come here and appropriate it, but you get no credit for giving it to them. And if you don't give it to them, you're cutting schools, okay? What we should do, and I hope someday when I'm long dead, somebody says, Kurt Doubt used to talk about this. And I hope somebody says, that's a much more responsible way of budgeting. We should figure out if we're going to give them 6% in the next biennium, give them 3% the first year, they'll actually get more money. You're front-loading what you're giving to them, and 0% the second year increase for a total of 6%. That has no tails on it, and it's much more responsible. So we always wonder why we have these big tails problems and why we work ourselves into deficits. It's because we're irresponsible in the way that we budget. The schools actually would probably like that because they'd get the same amount of money in the biennium, but they'd get it front-loaded. So food for thought, and when I'm dead and buried, somebody please do that.
Call on the author of the bill, the member from Hennepin, Representative Davnie.
Thank you, Mr. Speaker. Members, the voices throughout the chamber are right tonight. Education is a priority in all of our districts. In Minnesota, we don't fund schools, we don't fund buildings, we don't fund school districts, we fund kids. Vote green. Thank you, Mr. Speaker.
The member from Hennepin, Representative Winkler.
Mr. Speaker, I move that House File 1 be laid on the table.
Representative Winkler moves to table House File number 1. All those in favor say aye. Those opposed say nay. Motion prevails. Motion prevails. Representative Winkler.
Mr. Speaker, members, we'll have a brief recess while we wait for the reviser's bill to be ready. And so, Mr. Speaker, members, I move a recess to the call of the chair.
Representative Winkler moves a recess to call the chair. Any further comments? Hearing none, all those in favor say aye. Those opposed say nay. Motion prevails.